why might this be of interest to you tonight? Why would you want to know what your nutrient levels are? Well, probably most of you know a little bit about your family. There may be a few adopted people in the room, but most people know kind of what runs in the family. And what we often hear about is that maybe heart disease runs in the family, or maybe certain types of cancers run in the family, or what's even feared by even more people is Alzheimer's or dementias can oftentimes run in the family. And so what we have done over the last 18 years is refine what we're going to call the health panels. And these are the nutrients that cluster around these particular organs that set people up for these illnesses. You know, these illnesses don't just come out of nowhere. There's got to be something that happens in your body that puts you at higher risk for these particular types of illnesses to emerge. And our goal with this particular program is to help you find out before the illness emerges, to find out which nutrients you might be low in that put you at a higher risk for these particular illnesses, and then to intervene with some kind of a choice. Maybe it's changing your diet, maybe it's changing lifestyle habits, or it could be using a supplement. And so tonight I'd like to welcome our longtime director of the laboratory, Dr. Jim Jackson. Dr. Jackson was a prior professor, Professor Jackson at Wichita State. What area were you in, Jim?
I was chair of clinical sciences, and I was also a tenured full professor, and I was also associate dean of graduate school. Wow. And I also swept out the garage.
Janitorial services?
Work.
Yeah, extra. Yes. Okay. Well, now, as a professor, an academic guy, what made you interested in the center's lab?
Well, Dr. Riordan had lost the lab director that he had before or something, and then he ran out of C-sticks. I used to work in industry, too, with Miles Laboratories, and we invented strips to make vitamin C in the urine. And so he called me and asked me, could I get him any? So I just left Miles, so I called and got him 2 cases of C-sticks. And I gave it to him, and he said, and in his return, he gave me a keychain thing, and I called him up and thanked him very much for, $600 worth of stuff, and I got a little keychain. And then about that time, he was looking for a lab director.
Yeah.
And he said, would you be interested? I said, sure.
What have you learned being the lab director at the BioCenter lab that has surprised you about the value of measuring nutrient levels?
Well, when I came here, I was one of these double-blind, placebo-controlled things. If you didn't do that, I wasn't worth a toot, you know. And then I come here, and I would see people come in wheelchairs. 6 months later, they're up walking. I'd see people who had been told by their oncologist to go home, get your affairs in order. There's nothing to do for you. 6 years later, they're still here. Then I said, give me those vitamins. I started taking them. But the important thing to remember that I found out is that God, in his infinite wisdom, gave you this wonderful body. He also forgot to give you 45 things that you need to survive. You can't make any minerals. You can't make 8 essential amino acids. You can't make any vitamins except for a little D. You can't make omega-3. You can't make omega-6. So, you know, he's having a laugh at us up here. So this is one thing I found. And then you got to, like they said, you got to digest it and absorb it. Eating things is not what the secret is. Is that, as Dr. Kirby said, we have the saying called dame your food to good health. Digest, absorb, metabolize, and excrete. If you got any blockage in any of those things, whatever you put in your mouth is not doing you a darn bit of good. And the only way you can measure that, to see how you're doing with that, you must measure the blood and see what nutrients are low or not existing.
Yeah, but Dr. Jackson, I'm sure they're thinking out here, we're not biochemists. We can't understand all this nutritional stuff.
Good. I can say anything I want.
What about this? What is this? How does this help people figure out what their levels mean?
How many people take their car to the car dealership every time they send you a thing, or 3 months or 3,000 miles, get your oil changed and tires changed and rotate and everything. You know, I always ask this question. And then I said, how many people have had their blood checked? Well, 1 or 2 people. Then I say, why do you have your car checked and not your blood? They said, I need my car. I said, wait a minute. You don't need your body, but you need your car. And so what we have here is, actually, this is Dr. Ron's invention. You think of your body as a car, right? This is your fuel gauge. Essentially what you're doing when you measure these nutrients is you're measuring your reserve, what you have. Vitamin C, if you're low in vitamin C, the first 2 symptoms are irritability and fatigue. You're tired and cranky all the time. My wife says I need a walking IBC of vitamin C. but that's the first 2 symptoms. You can't make it. And if you use stress uses vitamin C. Dopamine goes up and up and up and up, and vitamin C is the main cofactor. More stress, more vitamin C, more stress, more vitamin C. So then you're out of vitamin C. Then you're in deep doo-doo, so to speak. And so what happens here is that if I was starting off on a trip, say to England in a car, I would want my reserves to be completely. This is why we measure your blood levels. We got certain things. You know, there's an optimal level, normal level, low level. We want you to be up in the optimal level because then your reserves are tremendous. You can do a lot of things. But if you start getting down, if you get
about like here's selenium, this is a report.
Thank you. I can read, Doctor.
Sorry.
I have 5 college degrees. I can figure that out. Okay, as I was saying before, this is selenium. And what you will get when you get back your report, you will get a colored copy of your report. And what you will find up here is that you'll get your result. If Dr. Ron will hit that with his magic marker. This will give your result and then give you what the normal range is, which is the mean plus or minus 2 standard deviations, which means you'll get back 95% of the people, quote, will be normal. Inside, outside, it will be abnormal. And then we have what we call an optimal range. Through research and reading various things, we found out what the optimal range is. Like vitamin D. For years, vitamin D was what, about 15 to 35 milligrams per deciliter. And then they kept up in Canada, they found out we got a lot of cancer up here. We got a lot of kids born with this respiratory bacterial infection. And then they measured the blood in the mothers and the kids, and they were all low in vitamin D. So they sold out, one month they sold out all vitamin D in Canada. You couldn't buy any because of this. And now the optimal range for vitamin D is 40 to 100. 40 milligrams to 100. So it's doubled, and now even regular doctors are prescribing vitamin D. And so what you want to do is make sure that your reserve is up. So what you do is you get this back, you say 130, that's a normal range, but I really need to be up here in the optimal range if I want to prevent cancer, prevent bone disease, prevent all this other stuff. So what we do is measure the nutrients in your body, and that's the only way you can tell that you've got something. Another thing we got is the VitaCheck C, where you measure your urine vitamin C, which is an excellent product, by the way.
So how would just the average person decide? We've got several health panels there. We've got the breast and the prostate and the heart and all the various panels. How would an average person decide which panel would be the best for them?
Depends on your family history. Depends on how much money you got. It's a joke. But if you're not sure about what it is, I would recommend the antioxidant panel because you're measuring your fat-soluble vitamins and you're measuring the water-soluble vitamin and you're measuring your urine vitamin C. Remember, ADEK, A-D-E-K, stands for all the fat-soluble vitamins, right? Everything else is water-soluble. So your kids in school, remember that ADEK is fat-soluble, everything else is vitamin C and vitamin B are water-soluble. So you can store the fat-soluble ones, but you can't store the water-soluble ones. Vitamin C, if you sweat a lot, comes out in your sweat. So you're losing it that way. And you can't make it.
Okay, very good.
Is that it?
I think so.
Am I dismissed?
You're dismissed. Thank you very much. Thank you, Dr. J.